Great.
Okay.
I am Sally Leisner. I am a practicing licensed massage therapist, neuromuscular therapist, and craniosacral therapist. I'm here today to talk to you a little bit about craniosacral therapy and how it can help you and your children. It's a very gentle, hands-on therapy. It has to do with the craniosacral system, which is a functioning physiological system composed of our cerebrospinal fluid, the membranes that contain it, in the osseous attachment, the bones, and mechanism that produce and reabsorb the cerebrospinal fluid. It has powerful influence over the nervous system, the endocrine system, and the immune system, and a total body effect. I started studying at Upledger Institute in 1993. I have studied throughout my career, working with children, infants, elderly, professional athletes. It's amazing some of the different things I've come into contact with, including myself suffering from concussion and getting great relief with this therapy. I am in this community, so I have several wonderful therapists that were able to reach out and help me in my time of need. So just a really beautiful skull here, and inside is where everything kind of floats around. And as you can see on the poster, this is just kind of all these different colors are different bones, and all of these bones are slightly movable with the fluid around them. So if you suffered a concussion or any kind of facial, mouth, any kind of trauma, we can do our best to take that trauma and turn it around and find a balance for you, whether it's deep here inside. When you do the craniosacral therapy and you free up everything through here where the spinal column runs through, this opens up a wonderful area for the nerves. All those little holes that you can see, those are like nerves run through there. And so compression through here can mean a lot of different things. The biggest one I like to talk about with parents is the vagus nerve. This runs through here. It's our longest nerve. It has to do with good sleep, digestion. Newborns have hiccups a lot. We'll get in here and release around the occipital ridge, and we'll get really good results as far as everything calming down in the nervous system. Things begin to balance. The fluid flow is really important, especially if you're dealing with something like a concussion. You can have an imbalance in your flow of fluid that comes through the hole, foramen magnum, and back through. This can be quite disruptive as far as how you feel on a daily basis. Pressure behind the eyes, nose, jaw, the whole cranium can be affected. And so we can help balance any bones that got misshapen. Possibly if you had a hit to the head, these bones will slightly go in a direction if they're forced. So if you were hit in the head, I hit myself on the mantle right here. I had speech therapy for a year because I had a little stutter, and the imbalance on this side was incredible. I also had some hearing issues, and it was just a little hit, like I came up from sweeping, hit my mantle corner, and it caused all that. But it happened to be just in the perfect spot to disrupt all of that right there in the speech center. Processing and saying a word could be really hard. So this got much help from my craniosacral therapist. And I feel really quite good these days, as well as it helps my memory. I had some short-term memory issues after my slight concussion, and that has repaired quite wonderfully. And the therapy is very gentle. You lay on the table clothed, and we start with breathing diaphragms that would be in this area here. And we move our way up from the pelvic breathing diaphragm up to the ribs through here. And then we do here. And then it's all occipital ridge back through here. Or if you could see better on the skull, through here. Once you loosen all of this up, then you can start addressing all the different colors of bones here. They're all done separately. Each bone takes its own sweet time releasing, but once you do release, it's pretty amazing. There's a bone here called your vomer. This sits back behind the eyes. This has a lot to do with migraines. This has a lot to do with reading comprehension, ADHD, many different things, as well as the sphenoid bone, which is a little bit harder to see. It's the red right above the orange, but it's also in there like that. And then I have a really pretty one. This is exactly what it looks like as it sits right behind your eyes. So it's like a butterfly, and this moves. So with all the fluid around it and all of the bones, this definitely can compress back toward the eyes. And I find that people will come in and they won't be feeling well, and that bone will be off, and it can also tilt. So the bones it's really important to keep that steady. And you can see how if there's pressure around here, how it's going to affect everything here, and then just right into the face, right into the temples, headaches, jaw pain, temporomandibular joint disorder can all be affected that way. We can also go inside the mouth, which is very fascinating. We can go inside and work the masseter muscles that are on the side of the jaw. And then also you can actually work on the nose bone right through the palate, right through the roof of the mouth. We wear gloves and do that. You can help the sinuses. It's amazing. I see quite a spectrum of people, everything from autism to ADHD. Maybe somebody has insomnia, not sleeping well. I also do any kind of birth trauma for infants. I see a lot of teenagers that have had injuries, sports injuries, mainly concussion. And there is a wonderful website I wanted to make sure that everybody has, Upledger, UPLEDGER.com. That is where I got my education from. There is a section at Upledger.com that has videos. And I'd love to invite all of you to go and check out the videos on concussion. There's numerous videos. And there is one with Ricky Williams, who is UT's Heisman Trophy winner. He started a pilot program with my school for former NFL players that are suffering with a lot of pain with their concussions. And it can be hard to get the help that is needed. And CST being an alternative sometimes can be the last thing that people find out about or try or get relief with. So there is an amazing video on concussion with Ricky Williams talking about his program that he did. And they did the studies, and they brought him in, and they did these great tests before, they did therapies, and they did wonderful tests after to show how much relief they got. So it can be really wonderful. If you can get in with a great therapist. Some of the other different things that craniosacral I have had experience helping people with would be chronic ear infections. It can definitely inside take pressure off the ear tubes. Failure to thrive in newborns, it can definitely help restart the nervous system. Any kind of new mom with lactation issues can definitely help her as far as getting good milk production, as well as it can help the baby with latch and any issues in the jaw, face, or head from birth or neck. Any motor coordination impairments can be greatly improved if the cerebrospinal fluid flow is flowing properly. It can make a really big difference in how processing happens. Processing happens for the completion of a motor coordination. Seizures have been also reported to be more controlled or less in activity after CST treatment. I have several babies that I have treated in my past years that had great improvement after their sessions with me, and they continued on to get the craniosacral. Also work a lot with sensory processing disorder that it can help calm the nervous system. Therefore, you can be around more noise and things going on. Helps a lot of kids in school that everything might be a little bit too much stimulation for them. It can calm that area of your brain and allow you to just be able to breathe through if you have sensitivity issues to that. Several of my autistic children that are high functioning autistic little clients, they tell their parents they want to come because they're feeling overloaded. So I feel when I get this, for me, every Friday I go to my therapist, that I just feel very light. Any pain that I'm having in neck or shoulder, I have a chronic shoulder that flares up once in a while. I always just feel lighter, better in my body, definitely better motor coordination and speech for me now. Typically is not a problem unless I miss a couple sessions, and then I can feel that I need to go for a session, but I usually get right back on track, which is wonderful. And I'm just trying to think if there's any questions anybody has.
I have a question about the vagus nerve.
Yes.
So we have a child in the organization that the vagus nerve is like shut down the digestion. There's her muscles are all just incredibly tight all the time. So she's having a hard time sleeping because it's like they're cramped all the time. And is that something I don't know if you've worked with anyone to that extent, but does it basically turn it back on or just strengthen it?
It helps everything around it relax so it can fire better.
Mm-hmm.
If it's compressed, it can definitely make it not fire correctly. I do have a child that I'll see later this afternoon, a little client that has cerebral palsy. Mm-hmm. And that he tends to do the really, really tight arms and really tight legs. And as soon as we release around the occipital ridge, right back here, through here, where these nerves come through, I can definitely see him start to relax a little bit more. And we also do some regular massage therapy with him that also helps. So you can definitely put the vagus nerve into a better environment.
Okay.
You can soften everything around it in case it's impinged against the bone by muscle. And the head actually, after I get a session, I feel like my head sits differently because all these muscles come up through here. And if they're tight, it'll be more of a presentation like this. And then if you loosen them and you lengthen them out, everything sits kind of different. So all of this opens, and a lot of people will say, oh, I'm itchy. I'm really, really itchy. And that's great because that's the sign that circulation's coming in and things start firing a little bit better back there. And I notice it a lot. It's kind of cool when I do a brand new baby. Sometimes I'll get called to a birth by a midwife, and the baby just had a little issue coming out or will be particularly swollen. As soon as we get right back there very gently and we just get that neck balanced, both sides balance out, and all around that opening just softens, you could just see that they'll move a little softer. Their breathing immediately gets nice deep breaths instead of a real panty type breath. And newborns are amazing to work on because we do see it in older children and in adults. It just takes a little bit longer to get there because we have stuff to relax through. And as we relax through our stuff and our stress, then we'll start to see the difference. So I see people all the time that come in also, and they're just not feeling good. They've had a bad week. Their stress is just really, really kind of getting them. And they'll say, like, as soon as we do the occipital ridge, like, wow, like everything in my head, the pressure feels different. Everything feels better. And a lot of times people have to get up and go to the bathroom. And that's just everything opening up and everything working. A whole lot better in your system.
Yeah.
Which usually makes for really a pleasant, happy feeling afterwards. And you'll be sleeping better. I work with babies that have reflux, and that can help them as well. All kinds of stuff there.
Liz, do you have a question?
Are they multiple? Sorry, Kim. Are the treatments multiple, or are they required to be multiple to be effective?
No, I see a lot of people one time and they feel really good, and then maybe they'll come back for a light maintenance. So it kind of just depends, first of all, the situation that you're dealing with, and just how fast the nervous system relaxes during the session. So it kind of just depends. Now, I figure like my story, it was pretty severe. On average, if we're dealing with something, sometimes I see people twice a month. Sometimes I see people once a week to start, and then we make a plan from there depending on how they are feeling after the session. So 80% of babies that I see, brand new babies that aren't latching or they're having a hard time with either reflux or colicky or gas and not going to the bathroom, a lot of times they're one session and they balance out and they feel really great after, and we get real good results. I get a lot of good feedback from those mamas. So I think it just depends on the situation versus somebody that is probably like in a car wreck or has a pretty good concussion. They might need a couple sessions. But you kind of got to get in there and do a session and see what's going on and see how the body reacts.
Great.
Yeah.
Megan, do you have any questions?
Hey, Kim.
Yes.
Hey, I was just curious. The reason I plugged in, I wasn't sure what exactly we'd hear, but obviously Riley's recovering from major reconstructive back surgery. So it's like, I think her sensories are in overload as far as her pain, her pain sensories, and just trying to get everything to kind of calm down.
Yeah.
I didn't know if there would be any benefit. Obviously, she hasn't done any kind of massage on her low back just because that's where the surgery was. But I was just wondering if there's a way to reroute or help the sensory, system or whatnot with that.
Yeah. This definitely would help calm the entire central nervous system.
Mm-hmm.
Once you get the fluid that flows there to where it needs to be, nourishing all the nerves, nourishing everything, I think it's great for pain.
Okay.
Yeah, I am living proof that it really does help with pain. I tend to have a lower threshold for pain, and so I also can't take any medications. I'm allergic to a lot of stuff that would be prescribed 20s after a car wreck that I can't have a lot of medications. I just can't, my body just can't do it. So craniosacral has been such a blessing in my life. And I really think that for pain, it's amazing.
Okay.
I have little pain, and I do try to keep up with my therapy because I can definitely feel it when I don't get it. So I think it's a wonderful alternative for someone that's having issues.
Okay, thank you.
Yeah, you're welcome.
So just to give you guys a little bit of background, my daughter's been going to her. She's had 3 concussions in the past, and she's also an athlete. So she has a lot of very tight muscles. And she has, I feel like she just had a meet, and I feel like her body is functioning all as one. There was just such a difference in how her coordination and everything during the meet. It was really interesting to see and watch, and I know she feels better too. So, and she's been to see her twice. She's going one more time this next Saturday. And then Tiffany Mandrala, she's also been to work with her and her baby with some mouth. She did some mouth work, I believe, right, on Tiffany's.
Yes,
daughter.
we hope.
Piper.
We have some latching, and her too that had fallen and hit her head as well. So she had a great session.
That's right. You worked with Maddie too. I forgot about that.
Yeah, I did.
So do you want to tell us how you work and how to contact you? And I can send out your contact information too. But if you want to just tell us how the setup works, that'd be great.
I have a website. It is sallyleissner.org, which is just my name spelled out, SALLYLEISSNER.org. And I do appointments by appointment only. I can do some house calls. I do have an office here in Pflugerville in my home. And I've been in my home for 23 years here in Pflugerville. I get lots of referrals from many professionals in the Austin area. So I have lots of recommendations if anybody needs or wants. And there's lots of great stuff on my website too that talks about it. I'd also like to invite everybody to the upledger.com site. Wonderful videos, lots and lots of information. And so yes, I've done 5 classes with them, and that's a wealth of information right there. All different kinds of people, testimonials and things on their website as well. So thank you.
That's great. Thank you so much for coming on here and explaining all this to us. I know it's probably going to be very helpful to a lot of the kids. So, and I know a lot of parents will go back and listen to this. So I appreciate you being here.
Yeah, and I'm going to give you all my number. My phone number is 512-964-9031. And you can always text me. I'm a little quicker on text and phone calls than I am on email. But I try to check email every evening. But I am solo, working alone, so I kind of do phone calls and emails all by myself. So it might be evening for email if you're trying to reach me. So feel free to call me. Thank you so much, Kim.
Thank you, Sally. We appreciate it. I'll go ahead and stop recording now. And hold on.